Good evening. Welcome to Left, Right and Centre. I'm Vishnu Som. And on the programme tonight, it's a 1-hour special today. First up, Dr. M. Vidyasagar, Distinguished Professor at IIT Hyderabad, Head of India's COVID-19 Modelling Committee. How much did our data crunchers and modelers know about the impending second COVID surge? Also on LRC this evening, the struggle of doctors and healthcare workers 24/7 in fighting perhaps the greatest scourge of our times. Preetha Reddy, Vice Chairperson of the Apollo Hospitals and President of Nat Health will be with us momentarily. And finally, the unstoppable anti-COVID force, Sonu Sood, on how he continues to fight for hope as India grapples with this crisis. But why exactly are we looking at this? Because once again, the numbers, they're looking bad. India's active caseload has passed the 34 lakh mark, with 3,68,147 fresh infections added in the last 24 hours, 6% lower than yesterday's spike. Over 3,417 COVID-linked deaths have been reported since yesterday, taking the total number of deaths to 2,18,959 in our country.
अगर पिछले 24 घंटे का डेटा एनालाइज करें तो पाते हैं 3,67,000 केसेस। तो शायद केसेस में कुछ हद तक हम देख रहे हैं कि केसेस में कुछ कमी पाई जा रही है, लेकिन ये बहुत ही अर्ली सिग्नल्स हैं। इसको एनालाइज करने की, इससे रिलेटेड एफर्ट्स करने की कंटिन्यूड बेसिस पर जरूरत है। यह भी हम आप लोगों की दृष्टि में लाना चाहेंगे। इसी तरीके से अगर हम रिपोर्टेड डेथ को देखें तो पाते हैं कि अगर कल यानी कि पिछले 48 घंटे पहले अगर उसमें देखें तो 3,689 डेथ्स अगर रिपोर्ट हुई थी, तो पिछले 24 घंटे में 3,417 डेथ्स भी रिपोर्ट हुई हैं। अर्ली सिग्नल्स ऑफ प्लेटोइंग उत्तर प्रदेश में भी दिखते हैं।
Well, the big question in all of this is when did our scientists and our data modelers actually get an idea that this was headed to a second COVID surge? Did they have an idea at all? And if they did, and they conveyed this to the government, then why wasn't more done to deal with the situation which was coming? Thank you, sir, very much for being with us. When did you know that India was facing a second surge?
So, I think generally everybody, the government and the scientific community, they knew that cases were beginning to rise. If you look at, for example, the number of cases in the state of Maharashtra, already by the first week of March, they were showing a very clear upturn. And at that point, we could not make a quantitative prediction. See, it's one thing to say cases are rising, anybody can say that. But to make a precise estimate of, make a precise estimate of when the cases would peak, what the peak might be, we did not have enough information at that point in time to make a reliable prediction.
So what was your prediction? Professor Vidyasagar?
On April 2nd, I'm coming to that. So that's when we formally made a prediction, April 2nd.
What was your prediction at that stage based on incomplete data?
Okay, so that's a very good question. There are two aspects to the prediction, right? One is what is the predicted peak value, and the other is what is the predicted time. Do you understand?
Yeah.
When will the peak come and how high will be the peak? And both are equally useful because the predicted peak that we showed to the government was very low. It was off by quite a bit. We said somewhere around 1.2 lakhs would be the peak. And you know as well as we do, that was quite badly off. However, the timing that we had predicted was around May 15th to the 22nd for the peak. And if I may, I'll just explain why that piece of information is important. Because there were some plans afoot at that point in time to bring on stream some solutions that might take, let us say, 3 months, 4 months to fructify. And we wanted to convey the message that no, we don't have that kind of time. Whatever we do now, it has to pay off in the next 4 to 6
So, Professor,
years.
just so that I understand you, in the month of March, you had data, albeit incomplete data, which you gave to the government with the submission that things needed to move right away?
No. That is, I'm sorry if I didn't explain correctly. I said that the data was available to everybody. They could see in the month of March, already the curves were rising, you can see. But that was not enough to make any kind of a reliable prediction. So the first formal presentation we made to the government was on April 2nd.
Okay.
Where we went with some sort of a quantitative prediction, which was pretty accurate in terms of the timing of the peak, but quite incomplete and inaccurate in terms of the value of the peak. And if you have been following our tweets,
I've been following this very closely. But my question is, in the beginning of April, when you did go to the government formally with a certain number and with a certain date, when we were looking at early May for this to peak, what was the response of the government then?
Yes, okay. So just to clarify a small error in what you've just said, when we went to the government on April 2nd with our quantitative predictions, we had predicted a peak of between May 15th to May 22nd. And if you have been following our tweets, we have actually brought the time forward, and we're saying that the peak is going to be in the next week or so.
Yeah, around the 4th of May.
Yeah, exactly. That's exactly what we're saying. So, and part of the reason for the peak coming forward is because the cases have been climbing more steeply.
No, Professor, I understand that, but I'm asking what happened when you, on the 2nd of April, went to the government formally and said the numbers are fairly large and the peak is going to be in the first week of May. How did they respond to you?
Oh, yes, that's a very good question. So what happened was that some of the focus shifted from long-term measures and medium-term measures to short-term measures. That is, bringing a bunch of beds on stream right away, making plans for oxygen supply, all these kinds of things that had to be done on a war footing. I'm not by any means saying that we were the only ones to flag this, but we were amongst the ones to flag that there is a need for an immediate response. And you can see that they did respond pretty quickly on
So,
that.
Professor Vidyasagar, in the 2nd of April, when you went to the government, did you project that by the 4th of May, a total number of active cases would be as high as 33 to 35 lakhs?
No. What we actually projected on April 2nd was that the peak would be around 1.2 lakhs. No, you're talking about active cases. So active cases we projected around 15 lakhs and new daily cases around 1.2 lakhs. And the peak we projected was around the middle of May.
So that's interesting. More than 1 lakh daily additions is something that you had predicted in the beginning of April.
That's right.
But sir, that is a staggering number.
Well, that was the peak that we had predicted.
And I appreciate that. But if in the beginning of April, right, and now we are in May, you had predicted that in a finite period of time, we would be hitting more than 1 lakh cases a day, how did the government take your advice seriously?
I think they did take the advice very seriously, because what happened was that a lot of the efforts that the government was making were reoriented from medium-term measures, which might have paid off in, let's say, 2 months' time, to very short-term measures that would start paying off very quickly in 2 to 3 weeks kind of a time period.
But have any of those measures worked, sir?
Well, I think that I leave to you, the journalistic community.
So that's not your domain, I understand that. But epidemiologically, and if you look at trends, and you look at the United Kingdom, it took 3 months of a lockdown and an incredible vaccination drive for the United Kingdom to beat the strain of the virus, which is believed to be circulating one among a few in India. If in the beginning of April, you sounded an alarm saying we are going to be hitting 1 lakh cases, and with the benefit of seeing what happened just a few months back in the United Kingdom, how can you say the government has done enough to react to your information?
See, the reason why I say that is because let us understand that in the UK, they in fact, during the first wave, did not take any countermeasures at all. they kept restaurants and bars open.
Yes, and we know how they suffered.
Yeah, exactly.
Right.
So now, because of that, the failure to take adequate measures during their first wave, their second wave was much, much more intensive. And please remember also that they started their vaccination towards the end of their second wave. Whereas in our country, we started our vaccinations for the general public on March 1st, before the start of our second wave.
But Professor Vidyasagar, this is the part I fail to understand. If on the 1st or the 2nd of April, you told the government that there were 1 lakh cases upon us on a 24-hour basis in a finite period of time, why did India not go in for a lockdown?
Because you see, a lockdown is a very blunt instrument. Actually...
And yet here we are, sir.
Yes, where are we? What I mean by that is, do you really think that where we are today, if we just lock down, we're going to get out of the pandemic? I don't agree with that statement. You see, if you remember what we did in the first round, we actually went for green zone, orange zone, red zone, highly focused containment measures. That is what is more likely to work than a kind of a blanket lockdown.
So why was that not done why was that not done after you sounded out your report in early April?
Well, that is not within our domain.
No, but sir, as I understand it, sir, you are one of the foremost scientists in the country. You sounded out, and you sounded out people in March, albeit with incomplete information. You had more information in the month of April, which you've just shared with us. And that information was more than 1 lakh cases on a 24-hour basis in a finite period of time. Was enough done? I mean, I think we can look at what the results there are right now. You can say, okay, the blanket, all India shutdown, not correct strategy. Whatever strategy, sir, micro-containment zones, red, orange, green, whatever it is. The fact of the matter is, with those numbers, have we done enough?
So, I think that yes, let's put it this way. First of all, the magnitude of our second wave was higher than the magnitude of second waves in Europe, specifically Italy and the UK.
Yes.
And higher than in USA as well. So in terms of what we could do, so some of the measures that have been put in place, like making up makeshift hospitals. So for example, the armed forces have swung into action to put up hospitals in various places.
Sir, respectfully, Professor, people are gasping for breath in Delhi. The measures which have taken place are very small compared to the requirements, sir.
Well, I'm not disagreeing.
So, Professor,
with you
let's
on
stick
that.
to your area of specific expertise. And let's just look at, number one, if there is underreporting, as has been widely believed to be the case, then how do we know the true number of cases by the middle of May or a few days later in May who would have perished?
So that's actually a question that I've been waiting for somebody to ask me. All these interviews I have given, nobody ever asked me, how do we as the modelers account for the difference between the reported number of cases and the actual number of cases? So the answer that I as a modeler would give is the following. Let us assume that cases are being underreported. And you would know that far better than I would because you're on the street, you're on the ground, and you know the situation. But the ratio of underreporting, if any, does not change from one day to the next. Do you understand my point? So if we predict the trajectory of reported cases, and that is beginning to show a downturn, which we predict at the end of this week, it's reasonable to expect that the actual number of cases, whatever that might be, would also show a downturn.
Okay.
The actual number of cases is very difficult to guess, but the reported number of cases is much easier to work with.
Right. All right, sir, we've run out of time on all of this, and perhaps we should talk again about the need for more data based on genetic sequencing and how that can actually serve your cause. We'll talk about that in another interview. I'd like to thank you very much, sir, for being with us out of time.
Well, it's always a pleasure to talk to you, and I look forward to being asked again all these questions. Thank you.
Right, sir. Thank you very much indeed. So here we are after the 2nd of April, when this data suggested that we were going to cross 1.2 lakh cases in a finite period of time on a 24-hour basis. We are now in a situation when our healthcare workers are struggling to ensure that patients in hospitals actually survive. Oxygen is a big problem. What really is the road ahead? We've all heard about the cases. It's time perhaps to look at the challenges we face and to look at some solutions. And who better to do that than Preeta Reddy, Executive Vice Chairperson of the Apollo Group of Hospitals, who joins us now. Thank you, ma'am, very much for being with us. First up, and I must confess, I've been discussing, the fallout of COVID on a daily basis almost. We just don't talk about doctors enough. We interview doctors, but don't talk about what's happening to them in hospitals, or frontline healthcare workers, or janitors, or nurses, or sanitary staff, or even cooks. These are people who make up the heart of your team. Can you tell us what they are doing to keep people alive now?
Thank you, Vishnu, and I'm, appearing here on behalf of 60,000 plus of Apollo staff and the entire country's healthcare workers. As we speak, in one location, I have two youngsters who are, between 30 and 40 years of age, who are literally battling for their lives, healthcare workers, frontline workers. And I mean, the whole organization is praying that they will come out of it. They're on the ventilator. They've had the best in class treatment. I have a young doctor here who hasn't gone home to see, he's had a baby, 4-month-old baby, and the only time is FaceTime. So, they talk to each other on FaceTime, but he says, no, this serving people or working in the front lines is more important. I will get some time off to be with my little child. There's a girl from Kerala, father died 2 weeks ago. She hasn't gone home because she feels, she's needed here. So I think the healthcare workers really, really have to be acknowledged within our country, outside our country, because everyone is literally working in the front lines. And to me, thank you, gratitude, whatever we do for them is just not enough. It's like there is so much to be done and to be thankful for. Of course, many steps have to be taken, but I must say that as a country, with the magnitude of the problem, so much has been done. Every time we started off saying we don't have PPEs. Today, India is producing PPEs for the rest of the world. We started off saying we don't have ventilators. Made in India ventilators are making the rest of the world look up. Innovation labs are innovating like real time, 24/7. And as I say this, we have the largest pharmacy chain, and our pharmacists are serving people literally 24/7, taking drugs to old people, people who can't really find, reach, access these. So I think this kind of work is going on in every part of the country, whether it's a small nursing home, a large hospital network, whether it's in the government hospitals, or whether it's, the small public health centers. People are really working, they're giving more and beyond what they can serve,
Sure.
because that's really the spirit of service. We are in a warlike situation, and we all have to work together for this.
So in this warlike situation, there are casualties, and there are casualties among doctors and healthcare workers as well. Many of them certainly fall ill. And therefore, how much of a challenge has it been for you in your hospitals to deal with the fact that your own doctors are falling unwell, your own healthcare workers are falling unwell, and therefore those who are still trying to save people or help people are that much more tired, more stressed, with so much more to do?
So, Vishnu, one is, if you just take some data and analytics, it's not as if the percentage of healthcare workers are falling ill. They are tired, they're exposed, and we have to look after them, yes. But I think generally the spread is there, and the spread is a lot. So the public at large is at risk, including our healthcare workers for sure. Mm-hmm. We as an organization have set up, quarantine facilities purely for our own staff and our workers, because they need it, and we're able to give that to them. In the event of they need care within the hospital systems, they have beds, and they will get the best in class whatever is available, because I think they deserve it. They're
Sure.
like our family. But just scaling up is what we've all been focusing on. We've tripled the number of ICU beds in each one of our hospitals. And, we're talking about 70 hospitals, and each one of them has ICU COVID beds. We've got AI, which is, again, a very innovative model done by my sister, where people can actually check into a hotel to quarantine themselves, and they will be monitored real time with technology and nurses. So that is happening. Apollo 24/7 is providing, again, 24/7 care for people at their homes whenever they need and consultation. So at any given time, Apollo as a group, today's number is 14,080 people being looked after, throughout. We can do much more. We need to do much more. I'm not, applauding ourselves. I just feel that we have to come together to do that. That's what I really feel.
So let me ask you a little bit about the government's plan to bring in final year medical students. It seems to suggest that, people are falling ill or we need more healthcare workers. What are your thoughts? These are all young kids in a sense, final year students still under supervision, being brought into a war zone. Your thoughts? I don't have a specific question on this.
So frankly, Vishnu, we don't have an option. Both final year nurses, final year medical students, and skilled workers in the healthcare space are really required. What we need to do is to give them proper protocols, give them like a mentor or guide. So typically there would be one experienced doctor, and under him 10 of these, because the bedside care, a lot of stuff, entry into the computer, a lot of stuff which can be done by somebody who's just intelligent and who's trained to this level. That load can be taken off from the more skilled people. So I think we need to do different layers and levels of skilling and get more people on board, because honestly, frankly, we don't have an option. So I think the policy decision to allow the final year students to come and work on the front line, the policy decision to move NEET by 4 months, to reward people who've done more than 100 hours of COVID duty, all this are steps in the right direction, because it really motivates people. It motivates the frontline workers who are tired. They know that at least somebody is giving them reinforcements. We ourselves from our medical schools have mobilized 2,000 people from our nursing schools and medical schools.
And are they enthusiastic? They want to get in over there, get the experience?
They're very enthusiastic. They're like passionate. They're young. They really want to make a difference. And I think that's important. Even if you hold somebody's hand and help them through the tough times, it makes a difference.
So let's talk about the other big issue at this stage. That, of course, is oxygen. Could you tell us a little bit about the existing oxygen infrastructure that you actually have? And that's been improved of late because you've got a plant which has also come into Delhi. How soon would that plant, and I think it's come from France, right? Correct me if I'm wrong. How soon would that be mobilized in your hospital? And, if you look at the long-term requirements for infrastructure, what can we learn from what we are going through now?
So, this definitely is a topic which has come up now and which is so important. One is that we need to thank countries in Europe or US or even Singapore for that matter for lending a hand, turning things around so quickly to help us with oxygen. As far as the oxygen is concerned, it was in a way unanticipated. We never realized that the requirement of oxygen would go up by 300 times, because there were that many patients needing oxygen. Also, the silver lining here is that only 17% of oxygen produced in the country is used for medical purposes, which means that there is oxygen, industrial oxygen, which can be converted to medical use as soon as possible. And now, of course, there's this wonderful train carrying oxygen. So many things are happening, trucks carrying oxygen, people swinging into action. So I think the private sector here has really stepped in to say that, we produce oxygen for our steel plants, for other requirements. Please take it and use it for our patients. So, you see a wonderful coming together of industry, of government, of healthcare providers to overcome this. Yes, we still have a few days more of literally living with our heart in our mouths, but I think we will overcome that. As far as the plant is concerned, it's being commissioned, I think, in the next 24 hours. So it will take care of a small percentage in one hospital of what we need, but definitely it is a lifesaver.
All right. One final question, ma'am. The emergency use of essential drugs. A lot of people would say our system is very slow. Perhaps it needs to be slow because it's a safety issue at the end of the day. But in a situation like this, what about emergency use authorization of essential drugs? Does that process need to be made faster?
I must honestly say that it's so much better than what it was once this crisis happened, especially during the second wave. But having said that, you know, the monoclonal antibodies, which we really need to start using, which means we have to get into clinical trials and use them. This tocilizumab, again, is, you know, it's become a very rare drug, and we need to get more of it, use it, get whatever certification required and make it available. Step up production of remdesivir, because we know that that is making a difference. The clinical teams are really saying that we need that. So I think multiple interventions like this have to be done. You know, it's never going to be quick enough.
Right.
You know, you might say I wanted it yesterday. But the thing is, now it is moving at a certain speed. We can double our speed. We can take a risk that we do it for clinical trials. So I think we should step up the number of clinical trials which are happening in the country. And I think the scientific bodies in the, you know, are, all the government bodies are very conscious of it. And I'm sure that it will happen soon.
Wonderful speaking to you, ma'am. Thank you so much. And hopefully those healthcare workers will find themselves in a better spot.
Stay safe, say a prayer for all our healthcare workers, and all of you be careful.
They are our real soldiers in this situation, always. Thank you, ma'am. Thank you so much. Wonderful speaking to you. Well, we're going to take a short break at this stage. And then coming up after that, one incredible COVID warrior, Vishnu Som. He's fought for migrants when they went back. He's now spreading the message. He's taking care of those who need help. He joins us in the next few minutes.
ಕರ್ಕೊಂಡ್ಬಿಟ್ಟೋಗ್ಬಿಡಿ ಅಂತ ಹೇಳಿದ್ರು ಸರ್ ಇಲ್ಲಿ ಊರಿಂದ ಅಡ್ಮಿಟ್ ಮಾಡಿದ್ವಿ 4 ದಿನ ಆಯಿತು. हॉस्पिटल की लापरवाही कैसे सिलेंडर तो लगा जो इसमें गैस नहीं रही है, देख लीजिए क्या पापा इसकी वजह से आज मेरे हस्बैंड की हालत है.
Well, that's just a small look at what India is going through right now. The number of cases, the number of patients suffering, the impossibility in many parts of our country in getting a hospital bed, let alone getting oxygen. That's a reality that so many are facing right now as we speak. Joining us now, one of the heroes over the last 1 year, a man who we've known as a star, but somebody who's been perhaps one of our India's brightest stars in this time which has seen so much gloom. Vishnu Som joins us. You know, we've spoken with you now over the last 1 year. You did incredible work when, you helped migrants move back home. And you've done so much more since then. One of the things that you are doing is, you're encouraging the vaccination drive, and you're also airlifting patients. Could you tell us a little bit about that?
Yeah, thank you so much, Vishnu, for having me. And, I think we are living in the most difficult times that I've ever seen in my life. And we all are in this together, and I run short of words when I see people desperately calling in the middle of the night to say their fathers, their mothers, their kids, and I can't do anything. I'm on the phone 24/7 trying to call people left, right, and center, trying to use all the contacts from the MDs of the hospital to the doctors, to the ward boys to get them beds. So I feel. Yeah, we are in difficult times. We have to fight this battle together. Like you said, this airlift patient, I remember a desperate call that came from Jhansi, and this guy wanted to get an air ambulance done and get admitted in Hyderabad. There were no beds available, but somehow I got those things organized and this patient is doing well. So I don't know how it's happening, but yes, I believe that if you believe in something, you can make it happen, yeah. But we are really helpless and we have no clue what's going to happen tomorrow.
Sonu, are you facing that same problem which so many of us and people across the country, across many cities or areas in the country are facing? They want to get a loved one, a friend, whoever, a hospital bed, and that's just not available. No matter how many phone calls you make, it's always a struggle. And it's not because people don't want to try and help you, it's simply because there is no space, there is no bed.
That's what, Vishnu, it's a helpless situation. When I call an MD of a hospital, they said it's waiting of 700 people. And every patient deserves to live. It's not about jumping a queue that you know someone. Or actually, the most of the people I get calls, I don't know anyone. They randomly call people left, right, my friends, and they said he's got this message. It's an 18-year-old boy, it's a 25-year-old boy. See, mother, I get those voice notes from the parents, at least save us. So every time I get a bed, in another 1 minute again, I'll get another call to arrange an oxygen bed or an ICU. Again, I try to get that bed, but it's a never-ending struggle. I've been from past many days when the whole wave started. 24/7. Yesterday I got around about 17 beds in Delhi, Haryana and UP. And it was a great day for me. Today I could get just 9 beds. So I feel very desperate that if I sleep, at least I have to get 8-10 more beds and save 8-10 more lives. So I feel, I don't know where we are heading to. And we know people, we are connected, we can use our good offices. But imagine about a common man who is waiting in an ambulance or with a small cylinder out in the hospital. So what he must be going through, I feel, this shall pass very, very soon.
The other big problem we face now is one of oxygen. As you try and save lives, how is this, perhaps the biggest problem at the present moment?
The most difficult thing to get it, an oxygen cylinder. I'm planning to get almost 400 oxygen concentrators in Delhi in another 4-5 days to distribute free of cost to all the people who need them. I'm also trying to get an oxygen plant I'm speaking to Taiwan government, French government, where I can get at least 4-5 plants in different states where we can provide oxygen to people, and these plants have the capacity to get almost 250 jumbo cylinders and almost 1,000 cylinders, apart from the oxygen that can be given to the hospitals. But they take 10 to 12 days to get those things installed. And what about these 10-12 days? But nevertheless, we are getting these things, activated. And I'm sure, till then we need to survive. And till then we need to just get few things connected to fulfill the demands that people are in right now.
So, how are you inspired by children the most? Because, you've set up schools in the past. You've given kids cell phones, right? Is that something that really drives you or inspires you that, look, dealing with adults is one thing, but they're little lives that need to be saved?
I think it's very important to get these little lives saved because they are innocent. They don't know what's happening around them. They haven't seen the world. They deserve to live longer. They deserve to study. They deserve to see the world, and then they have to take their own calls of their lives, Recently, I requested also, when I speak to a lot of parents, who are desperate to live, but they have lost the battle against COVID, and they have these little kids who don't have anyone to take care. So I've requested even all the governments that make a law in which all the state and central government passes a rule that any kid who has lost a parent in the COVID will have a free education throughout their life. Doesn't really matter whether they are in a private school or in a government school or they want to do MBBS, engineering, whatever studies, even higher studies. It has to be free of cost. That should be the law. Then only we can have a better future tomorrow.
You actually did something which was very interesting. You built a house for a widow in Bengal, provided a tractor to a farmer in Andhra Pradesh, and started a school for the viral warrior Ajji Shanta Pawar in Pune. Tell us a little bit about that. 3 separate cases, yeah.
I was Vishnu, not trained, equipped, like I always say, how to manage things. But I always believe you have to make sure that It's not about helping monetarily, which is a temporary thing, but you need to also channelize the whole thing, that what they'll be doing after 6-8 months, whether it was a martial arts school for that old woman, or whether you're opening schools in Calcutta, or whether you're generating some kind of a source where people get a channel to work hard on their own, and they can also inspire others, so that they can have a next generation who's working towards it. So yes, I'm trying to explore every day. I'm trying to learn every single day, and I'm still learning. But like I said, these tough times have taught us a lot of things. At least me, it has taught. But it's time for all of us to come together and do a bit, whatever little we can do. And I think everyone is doing it, and we are experiencing around us.
In all of this, there are obviously so many frustrations. It's hardly an ideal situation. Vaccinations is something we keep talking about, but at the moment we just don't have as many vaccines as we need. This, how have you dealt with this problem? Because you've been out and trying to get people to vaccinate.
There were two phases where there was a time when people were not ready to get vaccinated. We were all pushing them, okay, get vaccinated. And now when everyone wants to get vaccinated, we don't have enough vaccination to get it done. Before I joined you, I was just trying for a friend to get him vaccinated, but they don't have enough vaccination. They said you have to wait for a week or so. But like I said, now the whole country is ready to get vaccinated, but we need those vaccinations. We have to mobilize our resources. The companies, like we've heard that other foreign companies are also sending their vaccinations. So I think we need to give people hope that, just stay strong and we'll get everyone vaccinated. But the kind of numbers that we're getting in vaccination, they say it'll take almost 600 days for the entire country to get vaccinated, which is a shame, I would say. But yes, we have to pull our socks. We have to make sure that we get our country vaccinated so that we can save many more lives.
Sonu, somebody just sent me a WhatsApp message asking, ask Sonu why he does what he does. How would you respond to that?
Vishnu, I feel that I'm blessed. I'm the chosen one. I can connect with people. You believe me that, the kind of happiness that I get out of it, I haven't experienced in all these years. I've worked in all the different industries, from all Tamil, Telugu, Kannada, Marathi, Chinese, English, Hollywood, every Hindi film. But if you put all the things that I've done in my life together, it hasn't given me that much of happiness that I get getting a single bed for an individual every single day. When I call them, okay, the bed is arranged in so and so Gangaram Hospital or Ram Manohar Lohia Hospital, go. So they shiver, they cry out of happiness. They said, "Thank you so much, sir, for saving our lives." And when the parent get discharged, they said, you are going to stay a part of our family, part of our life forever. So I think I wish my parents were around to see that. My mom always used to say that, just apni mutti khol kar dekh, shayad teri haath ki lakiron mein kisi ki zindagi bachana likha ho. So I believe that, there is something written in my, I would say fate to save lives. So that's what I'm doing, yeah.
I don't think there's any doubt about that. You went through a bad or troubling experience with COVID yourself, right?
Yeah, I was affected, but it took me 5 days to come out of it. But I had more time, Vishnu, to help others. 24/7. I was on the phone because I was, quarantined. I was in a room, so I had all the time in the world, and that's the time I did maximum work. That's the time I got maximum, beds done, oxygen cylinders done, all these medicine, injection, remdesivir. Maximum I got delivered in those 5-7 days.
Are you relieved by the fact that there is so much aid now coming into India? You spoke about remdesivir. 125,000 doses came in last night from the United States. That's super news, isn't it? That oxygen plants have come in. We've got friends across the world, have we, in our hour of need? There's no doubt about that.
So yeah, this is a ray of hope. I'll tell you, one dose of one vial of this remdesivir, it's like a Sanjeevani booty. I gave around about 18 today to different people who needed it, and they were so happy. They said, "Sir, we'll come all the way." People were coming from different parts of Maharashtra to get that one vial to save their loved ones. So if you're getting so much of injections from abroad, I'm sure people won't have to suffer, pay black money to people to get these vaccinations, and they'll be able to save more lives. Again, Vishnu, I want to again mention that people who are not able to get those vaccines, I lost 4 people I was trying to save yesterday, and they always get, sir, we couldn't get that vaccination, and we wish we could get that remdesivir, and we would have saved a parent. So they don't know whether it's a life-saving drug or not, but they'll always have that regret in their life that they couldn't get that one injection for the parents. So I'm glad that so much of aid is coming from abroad, and I hope in a day or two everyone gets what they want.
So to tell us a little bit about how you're airlifting patients from where to where. It's an expensive proposition. How does that work?
I remember the first airlift happened from Nagpur to Apollo Hospital of this girl Bharti around about 15 days ago. And when she had lost 90% of her lungs, and from Wokat Hospital from Nagpur, we had shifted her to Apollo in Hyderabad. And through an ECMO machine, that was the first time I got to know what ECMO is. And it was a very tedious process of getting her airlifted, but now she's still surviving today. Yesterday, doctors had given up, but they said today she opened her eyes. So it was like a second life for me. I haven't met the family, I haven't met the girl, but it's a great experience. The kind of effort that we have put in, it's paying off. And the second one was from Jhansi to again to Hyderabad, which is the day before. And again, the patient is doing well. So, Vishnu, when you're doing it, you shouldn't think about, okay, for this particular patient, you are spending so much of money. Is it really worth taking those chances? You just have to come forward and do it. If you are able to save that life, you imagine the kind of happiness that you're going to give to the family. So it doesn't really matter. You just have to...
the ultimate sense of satisfaction to be able to do something for people around you. This is one small area where so many of us on a daily basis, when we get phone calls on the odd occasion, when we can save someone, there's nothing more satisfying than that. Nothing beats that sense. Sonu, it's so wonderful speaking to you. You've been so close to all of our hearts here in NDTV, besides anywhere else. And we really look up to people like you, and for all of the work and for all of the hope that you bring. Thank you so much for speaking to us.
Thank you so much. Thank you.
Well, there's been tragedy in Karnataka's Chamarajnagar district, with 23 COVID patients dying at a government district hospital in less than a day.
Tragedy in Karnataka's Chamarajnagar district, with 23 COVID patients dying at this government district hospital in less than a day. Relatives allege that a lack of oxygen caused at least some of the deaths. Rajana got an SOS call at midnight from his nephew, who had got married just a couple of months ago.
ಫೋನ್ ಮಾಡಿದ್ದಾನೆ, ನನಗೆ ಆಕ್ಸಿಜನ್ ಸಿಗ್ತಾ ಇಲ್ಲ, ದಯಮಾಡಿ ನೋಡಿ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಫೋನ್ ಮಾಡಿದ್ದಾನೆ, ನಮಗೂ ಮೆಸೇಜ್ ಮಾಡೋಣ. ತಕ್ಷಣ ಬಂದ್ರೆ ಇಲ್ಲಿ ಯಾರೂ ಒಳಗೆ ಬಿಟ್ಟಿಲ್ಲ. ನಮ್ಮ ಲೋಕೇಶ್ ಅಂತ ಟೀಚರ್ ಬಂದಿದ್ರು, ಒಳಗೆ ಬಂದರೆ ಯಾರೂ ಬಿಟ್ಟಿಲ್ಲ. ತಿರ್ಗಾ ನಂತರ ನಾವು ಮೆಸೇಜು ಫೋನ್ ಮಾಡಿದ್ರೆ ರಿಪ್ಲೈ ಇಲ್ಲ, ಅಂದರೆ ಹೋಗ್ಬಿಟ್ಟಣ ಅಂತ.
The government has ordered an inquiry headed by an IAS officer on the deaths that happened between 9 a.m. on Sunday and 7 a.m. on Monday. The report should be submitted in 3 days' time. The hospital and authorities made efforts to meet the oxygen shortfall that occurred shortly after midnight.
ಆಮ್ಲಜನಕದ ಕೊರತೆಯಿಂದ ಆಗಿದೆ ಅನ್ನೋದು ಸರಿಯಲ್ಲ. ಒಂದು ಡೆತ್ ಆಡಿಟ್ ರಿಪೋರ್ಟ್ ನನಗೆ ಬೇಕು ಅಂತ ನಾನು ಕೇಳಿದ್ದೆ. ನಿನ್ನೆ ರಾತ್ರಿ ಇದು ಕೊರತೆ ಆಗ್ತಾ ಬಂದಿದೆ ಅಂತ ಗೊತ್ತಾದ ತಕ್ಷಣ ನಾವೆಲ್ಲರೂ ಕೂಡ DCA ಎಲ್ಲರೂ ಕೂಡ ಪ್ರಯತ್ನಪಟ್ಟು ಸುಮಾರು 80 ಸಿಲಿಂಡರ್ಸ್ನ ನಾವು ಜಿಲ್ಲಾಸ್ಪತ್ರೆ ತರೋದ್ರಲ್ಲಿ ತರಕ್ಕೆ ಸಾಧ್ಯ ಆಯಿತು. ಮೈಸೂರಿನಿಂದ ನಮಗೆ ಈ ಸಿಲಿಂಡರ್ಸು ಸುಲಲಿತವಾಗಿ ಏನು ಬರಬೇಕಾಗಿತ್ತು, ಅದು ಸ್ವಲ್ಪ ತೊಂದರೆ ಆಗಿದೆ.
The MP from neighbouring Mysuru district from the BJP says he organised over 15 cylinders.
ರಾತ್ರಿನೇ ಸದರ್ನ್ ಗ್ಯಾಸ್ ಏಜೆನ್ಸಿಯವ್ರನ್ನ ಕರೆಸಿ ಅವರಿಗೆ ಅಲ್ಲಿ 15 ಸಿಲಿಂಡರ್ ಕೊಟ್ಟು, ಅದಕ್ಕಿಂತ ಮೊದಲು 50 ಸಿಲಿಂಡರ್ ಪದಕ್ಕಿಂತ ಕೊಟ್ಟಿದ್ದು. ರಾತ್ರಿ 3 ಗಂಟೆಗೆ ಮತ್ತೆ 60 ಸಿಲಿಂಡರ್ನ ಕೊಟ್ಟಿದ್ವಿ, ಬೆಳಗ್ಗೆ 7 ಗಂಟೆಗೆ ಕೊಟ್ಟಿದ್ವಿ. ಇಷ್ಟಾಗಿಯೂ ಕೂಡ ಈ ಒಂದು ಅವಘಡ ಸಂಭವಿಸಿರುವಂತದ್ದು ಬಹಳ ದುರದೃಷ್ಟಕರ ಸಂಗತಿ.
The opposition Congress criticised the government over the deaths. Rahul Gandhi tweeted, "Died or killed, My heartfelt condolences to their families. Karnataka has been struck hard by the second deadly wave of the coronavirus. In this district, cases have shot up by almost 4,000 in the last 2 weeks. This has strained medical infrastructure. And now, this loss in Chamarajnagar, leaving so many grieving families. Maya Sharma for NDTV.
In Madhya Pradesh, the low flow of oxygen caused 4 deaths in the Barwani district hospital. That's what the relatives of patients who died said. The district administration says that only one person died, that too because of a cardiac arrest.
Seen inside Barwani District Hospital ward in Madhya Pradesh, where oxygen supply reportedly became low for half an hour and pushed patients into distress and attenders into a panic. Relatives claim 4 patients had died.
सिलेंडर ऑक्सीजन लाइन बंद हो गया था, कम से कम आधे घंटे तक ऑक्सीजन लाइन नहीं चला और ऊपर मेरा पेशेंट उसी की वजह से एक्सपायर हुआ है.
मेरे बच्चे की सुबह से 94 ऑक्सीजन चल रही थी, एकदम से ऑक्सीजन बंद हो गई. आधे घंटे तक अफरा तफरी मचा करी हम बोला करे कि ऑक्सीजन चालू करो. मेरी गोद में मेरा बच्चा ऐसा तड़पा करा. ये इन लोगों ने कोई डॉक्टर नहीं और कोई नहीं, हमको यहाँ पर किसी ने हेल्प करी.
Even as anxious relatives vented their emotions, the district administration claims not 4 but 1 death had happened due to cardiac arrest.
जैसे ही शिकायत प्राप्त हुई तुरंत जो हमारे ऑक्सीजन मैकेनिक है उन्होंने 5 मिनट के भीतर आके उसको देखा और फ्लो को जो है नॉर्मल उसमें फ्लो को रिस्टोर किया. तो ऑक्सीजन का फ्लो कम होने से किसी प्रकार की कोई कैजुअलिटी नहीं हुई है. एक परिजन जो कार्डियक अरेस्ट थे, जो आईसीयू में थे, कार्डियक अरेस्ट से एक परिजन की मृत्यु हुई है.
ये हॉस्पिटल की लापरवाही, गैस का सिलेंडर तो लगा जो इसमें गैस ही नहीं है, देख लीजिए पापा.
In this video from AIIMS in Bhopal, a young man says his father was fitted with an empty oxygen cylinder, nearly causing his death. A probe has been ordered into why and how that happened. With inputs from Barwani and Bhopal, Uma Sudhir, NDTV.